Welcome to Windows on the World. This is a follow-up to our show, which was called NH Sell-Off Explained, which you can find on windowsontheworld.net. We have two guests today, Dr. Lucy Reynolds, who's coming in later, who was on that first show, and also Anthony Johnson in this first section, who's a student nurse and president of KCL Nursing and Midwifery Society. He worked for Leeds MenCap and a charity called Weekenders, and he saw cuts which gave rise to increased mortality in hospitals. He saw a reduction of funding under the so-called Big Society, which we've covered in many of our shows. We also have an article called Big Society Change Agents at windowsontheworld.net, which takes you into the wider picture of what's going on with a corporate takeover of everything. Anthony's worked in private care. He became a student nurse in London and saw the costs of training as a reason London is short of around 10,000 nurses. He states, along with many others in the NHS, that there is a determined effort to make the NHS implode on itself. So, Anthony, welcome to Windows on the World.
Hi, Mark.
Hi. Well, thanks for coming in today. And it's very interesting. You sent me some details about your background. So, just for anyone out there who's not aware of this privatisation that's going on all over the health service, it might be a good time to just go into the beginnings of where you started, how you got into nursing.
Right. Well, I guess I was working with a lot of learning disability charities up in Leeds, and obviously I really enjoyed the work. I enjoyed being able to feel like I could care for people, but it was also around about the time when the government came in, the Conservative government, and you started to see large amounts of reduction in funding for people's independence payments, so that it meant that quite a lot of our service users, they were, obviously they were struggling, their families and themselves, to get by. It meant that it was harder for us to do our jobs, and it was harder for us to be able to, properly care for them. So basically, we took so much money out of the public sector, and the reality was it meant that these kids, they were getting sick, they were not being able to go out there and access the same things that they used to be able to do. So it was affecting their mental health. It was making it much more likely, that they were potentially going to commit suicide, things such as that.
So, can you go into a bit of detail there as to what you mean? What exactly was being cut?
Well, so basically, there used to be this idea of independence payments for people with disabilities. So it was it was what allowed children who had disabilities and also adults to go out there and basically live normal lives. It's the way that we put in interventions to basically make them, as close as possible to being able to see what equality is supposed to be about. So it means that they're able to live productive, normal lives. It means they're allowed to work. It means they're able to contribute to society. So we've took that money away from them, and it's meant that obviously they then suffered because of it. They weren't able to afford their ability to live. They weren't able to go out there and experience life like we get to do. So it's created a situation now where quite often, especially now when I'm a student nurse, I'll see people from the other side of the coin where it used to be I provided, the respite care. Now I actually have to provide the physical care. And what we're seeing is quite a lot of people who have learning disabilities, who have mental health problems, they're now being bounced back onto the NHS because of the cuts that we've imposed in mental health services, because of the cuts we imposed to, disability living independence payments. And that's the reality of you cut somewhere and it's going to bounce back and it's going to cause loads of costs to other parts of the NHS in this case. And that's what we're seeing consistently. When I worked in private care, you'd find that private care companies, they don't give you the time to get to care for your patients. So it means that you just rush in there, just getting as little as possible work done, just so that you can fulfill the purpose of the contract. And everyone's having to do this, and that's what everyone's facing within private care. And you're going to start to see it soon actually within the community as they start privatising large amounts of that. So you're going to see district nurses not having the time to be able to do their roles and fulfil them. And it's going to mean that patients are going to get sick, we're going to have them unnecessarily getting ill, and then they're going to affect the acute care sector, and that costs us more money. It impacts upon our economy because we're having to spend more. It also means that instead of having these people who could be productive members of our society and productive members of our economy, they're not anymore. So we're creating a situation in which nobody's working, but the NHS is having to go into overdrive just to try deal with the amounts of costs that we're needlessly creating. And you know, we're seeing it a lot as well over the last couple of years with the cuts to public health spending. Needlessly, you know, I mean, it's a cliche, but they say prevention is cheaper than the cure. That's what public health is about. You're meant to go stop people unnecessarily getting ill and becoming acutely unwell. We're not doing that now, so it means that we're creating quite a large amount of cost for our society and for our NHS, and that's what is putting strain on it. So when I was working within private care, we'd always see people going in with urinary tract infections and getting pressure sores because we don't have time to be able to care for them. That then means that we're privatising the profits. These private care companies are taking private profits from the NHS because they're the ones who used to provide those services. And then they're socialising the losses, the fact that they're not providing an adequate level of care, straight onto the NHS. So this concept of bed blocking, that's occurring because we're not providing adequate care in the community. And that's why we need to socialise and nationalise social care. Because if we don't, it's going to create such a great cost upon the NHS that it's going to collapse. And obviously there's other forms of privatisation that the government's instituted. They've introduced PFIs. They've introduced the internal market.
Tell us a bit about PFIs.
So PFIs are basically ways in which they use private money to fund public sector investment, and their interest rates upon those contracts were so ludicrously high that I remember the figure used to be we invested 11 billion into the NHS. Because of the interest rates, it's going to take out about £80 billion. So there's nobody anywhere who thinks that that's a good idea. Even amongst the most radical conservatives out there, nobody's going to think that it's a good idea for us to have a payback rate of 8 times the value of what the contract initially was. And so it's needlessly dragging out quite a lot of money out of our NHS, and that's the reason why we're seeing a lot of the strains now, is because they've purposefully set us up to fail. They've purposefully set up a scenario where we've not got enough money to provide frontline staffing costs because we're going and paying off these ludicrous interest rates.
Now, none of this is being covered in the mainstream media. Why do you think that is?
I suppose, especially with respects to organisations like the BBC, they're also being privatised. They know that their contracts are also at risk, and there's a revolving door between the private sector and what is essentially, supposedly, the public journalism sector. So nobody wants to disagree with people like Rupert Murdoch because he may be a future employer. Nobody wants to go and disagree with the government because then they're going to impose drastic cuts upon the BBC, even though we know that that's eventually what's going to happen to them anyway. But rather than people openly advocating for themselves and speaking out about it, what they've decided to do is collude with them and help enable this scenario where nobody's talking about the fact that one of our greatest national treasures, which is the NHS, which I think an overwhelming majority of people, something like 8%, agree with and agree that it should be a publicly run and organised service. No one's talking about the fact that it's being privatised, and it's not. It's going to be privatised. It already has happened, basically. And I think that was something that the public should always remember, is that, straight after the war, we had no money. We had greater austerity than we have now. And because everyone got together and they said, this is what we want, this is a society we want to build, this is what we want to have for ourselves, we created the welfare state, we created the NHS, we created all the public sector organisations, free education, and now because of this stupid idea that we don't have enough money, we've then took it away from ourselves, and we've allowed politicians and a small minority of people to say, oh yeah, you're not going to be allowed to have your NHS now, you're not going to be able to have the public sector, because we can't afford it. But we obviously can do. If we're allowed to bail out banks, I think we gave something like 375 billion to them in quantitative easing. If we can do that, why can't we just provide enough funding to provide adequate care for our population? Not just because it's the right thing morally, but because it's good for our economy. If we don't have a healthy workforce, then nobody's going to be working anyway. And that's what I'm saying when I speak about what's been going on when I was working with disabled charities and working, in the private care sector, is we're needlessly going and taking people out of work and making them sick just because of supposed fiscal expediency. But it doesn't make sense, and it doesn't add up. And, you know, it's not a cost, is the NHS, it's an investment, and it makes sense because it pays back its dividends by us having a healthy population, and that's why we should retain it.
Yeah, you brought up loads of points there. The main thing is, though, is this corporatisation, this sell-off, and what we had was state services that have effectively been privatised in every sector, including the police.
Yeah.
You know, and people are seeing this more and more. But what we're now seeing is the people who are leading the country are merely corporate puppets.
Yeah.
They are just part of this agenda which you've alluded to there. And you've also stated that by privatising, what they're doing is basically because the services that are being provided are not being provided properly, the state is picking up the bill at the end anyway.
Yeah.
Yeah.
Well, that's why I really struggle to understand people who do support this idea that we can't afford anything because, well, we can't afford not to, because we're going to pay the bill anyway, and we're just going to pay it for a much larger amount. And at the end of the day, I'd rather have healthcare that provided for everyone rather than not have healthcare, and it costs us so much money for have nobody in work and for it to not be providing adequate care for people. And that's why, like, things such as the junior doctors and the bursary or bus campaign, which I'm part of, people need to refer back and draw back to the wider issue of the fact that this is about them privatising the NHS, and it's not just an accident that Jeremy Hunt decided to pick a fight with the junior doctors, and it's not an accident that when we've got so in terms of the population of nurses, there's 377,000 of them. Over 100,000 of them are over 50, so we know that they're going to retire within the next 10 years.
Yeah.
So it doesn't make sense for us to remove student nurses and midwives and allied healthcare professionals' bursaries, because we need to retain these people and get them into work, because if we don't, it's going to affect patient care and patient safety, and it's going to wipe out the NHS. So it doesn't make sense for them to do that. It doesn't make sense for us to not give these people a pay rise, because then all we're doing is going to drag in out those skilled workers out of our NHS, which then automatically is going to affect patient safety. So it's not just a coincidence that we've had 30 years of this process since Thatcher of them slowly undermining the NHS. It's been a planned and coordinated attempt to do so, and you know that's why we all need to wake up and realise that that's the reason why they're doing this, and that's the reason why they're attacking the junior doctors. So yeah, I guess that's what I'd hope that people would remember if they're looking at the wider picture.
Well, that's a really good opener, because you've just covered everything that we've been trying to say on this show since we started, really. We're talking about a takeover of everything. Now, the thing is, when you get corporations taking over things like health, it's never going to work, because a corporation works merely to increase profits and basically cut the level of service, because the level of service is obviously costing them money. So they're going to cut and cut and cut and cut. And we saw this with the privatisation of railways, with railway accidents. So it's really obvious that this was going to happen. And it's been what they call a managed decline. But that decline is it's quite desperate now, isn't it? Because this is what I'm hearing. We are at the state of implosion. Would that be too strong a word?
Well, I mean, so if you think about what's like this, so there was this stupid idea of things will be more efficient if we start closing down a lot of district general hospitals, and then we start concentrating services into these big, large tertiary referral centres. But then the idea was that quite a lot of them are based in London, and practically every single trust within London now is running deficits that are at least 15%, if not higher. They're not going to receive additional funding, and so by the end of this tax year, I don't see how it's not going to implode. Like, there's literally no way that they're going to be able to withstand the amounts of costs that are being imposed upon them. And whilst they're running around constantly trying to say that we need to make efficiency savings, they're also fining them trusts for going and trying to increase the number of nurses and for the amount that they're having to spend upon agency staff. But the reason they're having to do that is because they're not training enough staff in the first place.
Exactly.
So the end point is they're fining them, undermining them again, and creating a situation in which they're having more financial penalties imposed upon them, which at the end of the day still attacks patient safety, ruins the NHS, and causes it to implode. And the reason it's not just a London-centric issue, because with all these tertiary referral centres based within London, if you collapse the London's health service, it's going to basically send a shockwave throughout the rest of the NHS, because suddenly all these patients who are severely unwell, now they can't go to London. They have to go to all these other tertiary referral centres that are dotted around the country. So then they start to buckle up on the pressure, and it slowly then causes the entire NHS to, collapse and implode. So that's why it is basically like a kind of do or die moment. Within this next year, you're probably going to either see them roll in loads of private companies and afford them a lot of contracts, or you're just going to see that health service wipe out.
Yeah, so they're just going to be farming out the debt, basically.
Yeah. So.
Okay, we're going to take a short break, and we're going to be back after the break with Dr. Lucy Reynolds. Welcome back to Windows on the World. We're now joined by Dr. Lucy Reynolds, but I just wanted to refer to a couple of shows that we've done about the NHS sell-off. One is called NHS Sell-Off Explained, and there's another one called Stand Up to NH Sell-Off with Dr. Rishi, who's a junior doctor. So we're going to return to the conversation with Lucy and Anthony. And Lucy's a researcher and National Health Action Party member. She's run medical services in the private sector and has seen the results of health service privatisation. So welcome back, Lucy.
Thank you very much.
We covered quite a lot of this stuff on the last show, but I think a lot of people are going to be quite shocked about what Anthony's just had to say. So do you want to give us your view of what's happening at the moment? Because we did a show a few weeks ago, wasn't it? So have there been any updates? Have you seen anything else happening?
Well, we're seeing a kind of a grand scale plan unfolding in which our hospital sector gets privatised or shut down. We are going to have a lot of care in the community, which I don't know if you're of the vintage to remember the last lot of care in the community. But
well,
that's what
people getting stabbed at tube stations by paranoid schizophrenics and that sort
quite.
of thing.
It was about selling off the mental hospitals, so
Yeah.
they need an excuse to empty them, and that was it. So they think we're daft enough to fall for the same thing again. So that's actually officially the narrative. McKinsey's, I think, suggested it to the management consultants. So that's care in the community. So that's what's happening on the provider side. Meanwhile, the GPs are being swept into an organisation which is actually being run behind the scenes, it would appear, by an American insurance company.
Can you give us the name of that company?
Yes, it's United Health, which has been, it was dabbling in GP services directly a few years ago and was responsible for a disaster in Camden which left the best part of 5,000 people without a GP.
Right.
And since then they've got heavily involved into what's called commissioning, which basically means paying for things. They're handling the budget. And they've got their guy right in to the top of the NHS. He holds the most senior post in the NHS. He's an interesting individual. His name is Simon Stevens, and he graduated in 1987 with a PPE degree from Oxford. And then he spent a year in South America helping privatise the National Sugar Corporation. And at the end of that, somehow he had got together the credentials that are necessary to become a fast-track NHS management trainee. So he spent a few years running hospitals and district health authorities, despite still being basically in his early 20s. So when he started this, 22, 23, he got sent over to the States to learn about American healthcare, and then the next thing, he pops up as an advisor to our government. He was working for the Secretary of State for Health for quite some time in the early 2000s, and then he ended up at Downing Street as the health advisor to Tony Blair. While he was in the Department of Health, he became very, very influential, was allowed quite a lot of control over what was going on, and a lot of changes which were put in are supportive to the shift to an insurance company-run, insurance-based system. And that's what we're seeing. It's called all kinds of things which sound a lot nicer, like STP is
what does that stand
name.
for?
Sustainability and transformation plans.
Sustainability, Agenda 21 or Agenda 2030 as they call it.
Indeed, and transformation, we also hear transformation, modernisation, these are all the usual jargon.
Yeah.
So yeah, I mean, forgive me, I'm not even up to date with what the acronym means, because I know there's no content in it,
That's right.
I just need to give the buzz name that's for people to recognise. The other buzzwords we have is integrated care, and I'm considerably more interested in unpacking that, because that is the name of cut-price American healthcare run by insurance companies.
Yeah.
So that would be healthcare which is delivered by insurance companies for insurance companies broadly. And that provides a nice counterpoint in the system. If you just privatise all your hospitals to your cronies, what you get is an explosion of cost. Because the patients don't really know what's wrong with them, that's why they go to doctors, and so it's an opportunity to just overcharge people. And it's not that there's anything wrong with doctors, you know, but these things attract the wrong types of people. They attract exploitation, and that has then gone on to a commercialised basis. So you've got one of the healthcare companies, HCA, Hospital Corporation of America, which is now over here and doing a lot of NHS work and also pushing a lot of private work in this country. And they got in trouble in Florida for the fact that half of the heart operations that were undertaken seemed to be being done for the benefit of getting the government to pay back a reimbursement claim to the insurance company and not for the benefit of the patient's health. They had put lies in the patient's notes to justify the operations. So we've got shysters like that coming in who will push the costs up as far as they can. So what they do in the States is limit this explosion of privatised healthcare cost by putting the insurers in against. So the insurers want to avoid spending the money because they get to keep what they don't spend. Yep. So that certainly limits the hospital cost explosion. But what you get is squeezed between these two juggernauts, the poor patients, who are, you know, individuals and ill, let's not forget. And what then happens, of course, is that everybody's trying to make money out of the situation, and that can cause the patients to be having heart operations they don't need on one hand, or possibly to be in a life-threatening situation where there is medical care perfectly able to deal with it, but not able to access that medical care because there's a barrier being put between them and it. And one of the great strengths of the NHS that I grew up with and you grew up with is the fact that it's accessible to all. We basically delinked completely paying for the thing and running it from actually delivering it. And therefore, the idea is I pay when I have money, when I contribute to the tax take, then I pay partly for the NHS. I don't need to think about it or do anything special. I can't be left out of the system. When I'm ill, it's there and there is no barrier. There's no credit card checks or insurer details to be provided. There's no insurer's clerks I have to satisfy with, you know, making sure I've ticked all the boxes. Because let's face it, their incentives run to denying care. And so that's what the new system will be characterised by. We are having a system increasingly where GPs are going to be allowed to keep the extra money that's not spent on care for the patients that are ill and that they refer for care. Now, the last time we had a bout of that that caused problems was one Harold Shipman, who was the face of consumerised medicine at a time when some previous government decided it would be very good to introduce a market and let GPs be the gatekeepers to that. So previously it was GPs, now it's a giant insurance company. But looking at what one GP did there, and to be fair, the other, you know, many thousands of them didn't do anything like this, but he had a trail of corpses behind him. And when it was looked into as to why he did this, I think there was one dodgy will, but generally it rather looked as though what he was doing was assessing his patients to see which ones were going to start getting expensive soon, much more expensive than the amount of money he was receiving from the government as a subsidy to pay for their care. And so he was causing some of them to have fatal accidents. His patients generally loved him. I mean, you know, actually patients quite often love consumerised medicine because it's not until you get dead from it or harmed from it that you come, you know, to have the other opinion. But if you're dead, then you're not speaking any longer. And they've got a lot of advertising and marketing. So that's another skew we're about to see in the system. People encouraged to take more care because somebody's profiting out of it, or less care because somebody stands to make money out of denying it. And we're moving away all the time from what a fair system ought to offer, which is when people are in need of medical care, they should get it.
Yeah, well, this is very, very revealing, and I don't think the public are aware that we're in this sort of situation. I think if they get involved in the health service and they get ill, they start to find out that it is actually breaking down.
Yeah.
But there's more and more people dying. When they're going into hospital. Is this something you would like to comment on, Anthony?
What?
Mortality in hospital.
Mortality.
Something you brought up earlier.
Yeah, I mean, that's why I never understand this. Because if you're a massive corporation, you need people to be healthy anyway. So you need them to be able to.
Well, only if they're working for your corporation.
Yeah, but that's the reason though why you need to have a nationalised health service, because it doesn't make sense to have people be sick anyway. So I don't understand why. Well, I do understand it's just because they feel like they can make money out of it. But for the majority of the public, it can't make sense to them to let them become involved within the health service because it doesn't function as a proper market. You're not able to choose which provider you're going to go to because you're sick, so you're limited by the place that you're stuck in geographically. So you can't shop around. You also don't have the expertise to make that choice. The way that the government's supposedly tried to make that easy and accessible for you is things like the family and friends test, which is a stupid metric on about whether or not you're receiving an adequate level of care, because you don't know what you're really judging. I mean, I wouldn't...
Can you explain that a bit? Because I don't even know what that is.
So basically, it's like, it is essentially just whether or not you're receiving good, basically a good service. But what it turns out is that most people are going to rate people who are nice to them. So you're going to go say that a service that gives you good customer care, or good customer service, sorry, that's going to be rated higher than, say, if you got a really rude nurse. But that doesn't mean whether or not you're actually going to receive an adequate level of care. You're just going to go to the people and say that the people who were nice to you were better. So then it means that you're basically setting up a system where we're saying that all the NHS is so lovely, it's so nice, but they could be going and killing people all the time. And that's essentially what we're setting up now is, we've got a much more focus on targets and how are we gonna are we gonna get enough of these surveys filled in? Are we gonna get enough people discharged? And it's not really concentrating on whether or not we're actually gonna treat people the way that they need to be treated. And are we gonna, because as I was saying before, it's gonna cost us more money in the long run anyway. But there's this idea of short term, we're gonna go drive down costs as much as we can do. And it means that we're discharging people who probably shouldn't be discharged. We're driving a lot of our care, as Lucy was saying, into the community, even though we used to keep a lot more people within the hospital, but it's because we're losing beds by the thousands every year. So yeah, I mean, we do see it all the time within the NHS, is that it feels like we're driving against what we would want to do, what our nature is to basically make sure that our patients are safe.
It's exactly what Dr. Rishi was saying the other week, junior doctor who came in. It's compromising your ability to do your job properly, which must be extremely frustrating, and that's ultimately going to make people walk from the National Health Service and just work in a private sector. So the whole thing is a bit self-defeating, but corporations only think of short-term profits. They're thinking of this year's profits. Then they're thinking, how can we drag down the services so we can save money next year, so to give to the directors. Now, this is not the way to run the health service. We alluded to that in the first part of the show, but how are we going to get this over to the public, Lucy? Because you've been trying to do this for quite some time. We're going to go for a break in a minute, so make it a bit brief. We'll come back.
Well, really, the secret is to get people to understand the situation and what is to be done about it. And unfortunately, people understand neither, because there's been an enormous marketing campaign devoted to making sure that they don't understand it, unfortunately.
Exactly.
For example, this promotion of the friends and family rating. There's an interesting research study in the States that showed that the people who were the most satisfied were actually almost twice as likely to die in the next couple of years as the people who are least satisfied. And we think the reason is because the ones who are least satisfied were not being told what they wanted to hear, and what was to sell them extra procedures that maybe hurt them. We need to get people to focus on the point of medical care. It isn't to be flattered and to be cosseted. It's when you are actually seriously ill, you need to deal with that. But they're taking out all the metrics from the system and switching them over to a consumerised, competitive system in which the different parts of the system fight each other instead of collaborating. And we really need to get the word out to the public that that is what's happening. So thank you very much for your contribution hereby. Well,
thank you for your contribution. We're going to take a short break, so there you go. That's what's happening in the NHS. We're going to see you in a couple of minutes. Welcome back to Windows on the World. I'm with Anthony Johnson and Dr. Lucy Reynolds, and we're talking about the privatisation and decline of the National Health Service. So welcome back.
Thank you.
Thanks.
Before the break, we were talking about mortality in hospitals, and also something that I wanted to bring up was this new idea that they seem to have that they don't allow you water. I had an accident and they were just saying, don't drink water, but surely if you're in shock, you need to rehydrate. This was something I found quite strange, and because I hadn't been in a hospital for a long time, it was a new thing. So what's behind all this, do you know?
I can't really comment on your personal case because there could be a medical reason why you were told that. But
well, I broke my arm. Yeah.
Okay, I'm not an MD and I stay well away from anything on the medical side. But certainly, I think you're right, there is an issue around water. And there's the Liveable Care pathway.
Which they've renamed, haven't they? Or they're not
Rebranded,
yeah.
They rebranded it, yeah, they've rebranded it. Yeah.
It would seem that people are getting put on that, sometimes with the patients and indeed their families' consent, although maybe people don't necessarily understand what's actually involved. But then we are hearing cases of where it's being people are being put on it with neither the patient's nor the family's consent, and in cases where it's obviously considerably inappropriate.
Well,
there are lawyers starting to hear of cases all over the country. So I think I'll need to refer you to some other guests to go into a great amount of detail with that, but there are also other reasons why people are coming a cropper in the health service. They are deliberately disorganising parts of it. So they're shutting down A&Es systematically, and we are seeing a doubling of death rates among people who live near that A&E and have to go to an A&E because they've got in trouble. So basically quite a lot of them are dying in ambulances quite unnecessarily now. And within the hospitals, things are being organised in very, very strange ways these days. I had a relative who was supposed to go into hospital for a couple of days, 3 days I think. They messed up the administration, so she was stuck there for a month. They gave her 2 new infections that she didn't have to start with, a respiratory infection and also a urinary tract infection, which she developed because she couldn't get enough to drink. The reason that she couldn't get enough to drink was, firstly, it was difficult to get water to drink, and secondly, it was difficult to get a bedpan.
Why is it difficult to get water?
Because there wasn't enough staff and they seemed to be rushing around doing weird things. And one of the things that they were doing, which seemed entirely inappropriate, was that the Secretary of State for Health had recently announced that all patients were to be given every opportunity to complain about the NHS. So the nurses were quite literally, I'm not in any way exaggerating, they were bringing around a questionnaire every 2 hours in which the patients were questioned about a whole bunch of patient satisfaction aspects. And they were given the opportunity every 2 hours to complain about not being able to get a bedpan, but the reason they couldn't get a bedpan was, among other things, that the staff were busy bringing questionnaires. Allowing the patients opportunity to complain every 2 hours, but not giving them decent conditions of life. And you know, if you keep old people immobile in bed with not enough water, developing various infections, they're going to die in higher numbers. So, I mean, I don't know whether anybody's having a look at the statistics in the geriatric departments, but I think it would be a good idea because they're not being run in such a way as to keep those people alive. In fact, as somebody who's previously run hospitals, if I saw that, I would say, what are you doing? Are you trying to kill these people?
Well, that's a really good question because it's a question I've asked, and I've had several people on show the last couple of years who are implying just that. Elderly relatives being taken into hospital and not coming out again. Often for quite minor things as well. So, have you got anything you'd like to say about that, Anthony? So, is it something that you've had any experience of?
Well, I don't want to say what hospital I'm on placement at, but I do tend to do like 8 bank staff shifts there as a healthcare assistant. And on Sunday when I left, they said that the entire wing of this hospital, and it's like 12 floors, each floor basically has a ward. There was apparently 12 registered nurses in that entire wing because that was the amount of nurses that they could get to provide care. So usually you'd expect to have around about like 4 to 5 nurses on every ward. So if you can do the maths, there was probably around about a good 60 odd nurses short or something like that. I mean, that's the system they've created now, where not just from in terms of like what the conditions are like within the NHS, but the cost of housing and the cost of living. They've pushed a lot of staff out of the NHS, and now it's affecting patient safety. And so it means that you're ending up with scenarios like Lucy's just mentioned, where there's no staff to go provide like the fundamental care that you need to stop people unnecessarily getting more ill. And so that's what's causing a lot of these scenarios where people shouldn't really be coming into hospital and developing UTIs. Realistically, I mean, they have a lot of campaigns around like how we avoid them, but it's basically, it comes down to the fundamental principle of you have enough staff, you don't have these situations coming into play, you train staff properly, you don't have these situations occurring, but then what you end up seeing is they reduce the number of staff, they cut frontline services, they cut what's called continuing professional development. so that you're not adequately training staff once they're registered. So then it means that you've now got staff who aren't keeping up to date and now are potentially unsafe caring for patients. So then also when you cut funding for their education, you tend to find that staff are more likely to leave. Again, that undermines the health service and affects patient safety. So every single policy that you're seeing put into place these days, if you were to critically analyse it, you'd think, why are you even doing this? Because it doesn't make sense to be pushing people out of the NHS, but that's what they're doing.
And when we see that, and it's being reported at all on the media, which it isn't as much as it should be, but when it is, we get reports like, oh, in Stafford, patient drank out of a vase of water. Apparently that's apocryphal. And then they say, oh, hundreds of people died extra, but we don't know exactly how many. It's basically all kind of turned around to make it look like the NHS is dreadful, and the big narrative is, oh, because it's not enough, they've not got enough money in the NHS, we've not got enough money in the NHS. We are spending £25 billion a year on running a market so that the officials and other gatekeepers, cronies, can get their snouts in the trough, and so that an American insurance company can take over the NHS. Not a penny of that 25 billion helps patients in any way at all. It tends to make their care inferior to what it would be otherwise. And yet we're told all the time about, oh, there aren't any staff and patients are dying because the NHS has got no money because it's all too expensive to have an NHS, so we must privatise it. This is a really cynical lie. And I spend a lot of time attempting to get people to understand this, because honestly, when you understand that, you kind of understand where we're going wrong generally, why things are run as they are. But it is perverse, and the media is being employed really on the front of a wave of PR. They're provided the stories and they just print them. They don't understand them. They don't know anything themselves.
Yeah, we talk about this all the time. I mean, what happens now is we don't really have any journalists. We have people who read PR. So they get a press release and they relay that to the camera.
Yeah.
And this is what we see all the time. There's no real independent journalism or thought going on here. But what you've just explained there is basically the way to look at it, I suppose, is that what's actually happening is the opposite of what we're being told. So in other words, it's working in a completely opposite direction than we're being told.
Yeah.
Would you just like to wrap up with that thought and expand on that?
Yes, I would. I've worn this T-shirt for a reason. This is a lovely quote from Anya in Bevan. People are very familiar with it. The NHS will last as long as there are folk with the faith to fight for it. I would like to identify that this is the wrong message. We have got far too much faith and far too little investigation of the facts and bringing criminal prosecutions against people who are blatantly ripping us off. And yet we continue to engage with the system as though there's not anything wrong with it. I think really people need to wise up. And as well as faith, which is certainly very important, we need to have a vision of what's possible, what it is we've lost, what it is we could have again, and how little it could cost compared to what it's costing now. And we need to start pulling together the skills among the public to deal with the fact that we have got a corrupt bunch of people in charge who are basically asset stripping us. We need to mobilise and fight that back.
On every single level. Would you just like to wrap up with what you want to say, Anthony?
Well, I suppose just to pick up on your last point, I mean, what we see is that nowadays that instead of this idea of like journalists being objective, they would much rather be neutral and portray both sides of the argument as if they have equal weight. But if the facts are the facts and it doesn't make sense to do it, and it is going to destroy our NHS and it is asset stripping our country, all of us have a duty then is to be objective, to say what the facts are and to put them out there to the public. And we shouldn't be going around and portraying the other side's arguments just because we're supposed to be neutral. That's not what journalism or our roles within the health service is supposed to be about. We're supposed to be professionals. We're supposed to go out there and say, this is what the reality is and this is why we're doing it. And we have the evidence to go prove it, whereas the other side doesn't. So I don't understand why we're in a situation now where we have to go listen to things like what Jeremy Hunt's saying if he's got no evidence to back it up.
Well, a lot of the time the people who are working in the NHS, their hands are tied because obviously they're contracted and they can't come out and say anything. This is the same with every single part of society and the way everything's being re-engineered. That there's these gagging orders on everybody. But that point about journalists is really good that you've made there, because there's this idea of impartiality, but they're not being impartial. Yeah. They're just showing huge bias. And if we had any investigative journalists left, then that would expose what's really going on. But without that, we've just got these PR reading clowns that we see on television, and people have been lulled into this fake reality. And it's on every single level. It's not just a health service. But would you come on again, you two, to discuss more on this and give us some updates?
Be delighted to.
Thanks very much. Well, that's it from Windows on the World. Keep watching those, watching us, watching Windows on the World, and we'll see you next week.